Hi everybody, my name is Dr. Jonathan Kuttner. I work as a pain specialist. Now, what I'd like to introduce is a fascinating concept which I deal with every day, and that is this, that a lot of people will injure themselves and they'll get better. So they'll twist a wrist or an ankle or hurt something and they'll get better within 4 to 6 weeks and it's gone and they're cured. And that's very, very common. However, there is a large group of people who injure themselves initially. Sometimes the injury is really trivial, but it doesn't get better. And 3 months later, they just bent over and did a little thing and felt something in their back. Or twisted and felt something in their neck or in their shoulder or in their arm or in their butt or somewhere in their body. And 3 months later, it still hasn't got better. And for some people, it not only hasn't got better, but it's kind of spread. So it started off here, and now it's running down here and a bit into your head, or in your back, and then it's running into your butt, or it's running around here. And it's really starting to get you down. And you go to different practitioners and each one tells you, it's your this, it's your joint, it's your this, it's your that, it's your muscles. And so each practitioner tells you the thing that is wrong is the thing that they treat, which is just how it is. You know, if you're a hammer, every problem is a nail. So, and the thing is that you go there always with the expectation that that person's going to help you and make you better. But you don't get better. And now here's the question, what is actually going on? And this is a massive problem in the world, not little, it's a massive and growing problem in the world. It's called chronic pain, which means the pain has lasted longer than 3 months. And what happens in the vast majority of people is the problem which started in your body heals. But it has turned on a problem in your pain system. And your pain system includes the nerves that pick up the messages. The messages then are transmitted up the spinal cord and up to the bit that really matters, which is your brain. This is the system that gives you information all the time. And part of this information system is that when the message gets to a certain intensity, you feel it as pain. And what has happened is the signaling, the way that the messages are handled, has now started to malfunction. Messages are actually being picked up from your body and they're being amplified and they're being twisted and changed. You feel it as terrible pain. The pain you feel is as bad as when you first injured the area. The area is healed, but now the messaging is now abnormal. And so this is called central pain system sensitization or amplification. And this primary problem, this turns out to be the primary problem for a very high proportion of people who have pain that goes on and on. The reason I'm telling you this is so important is that you can carry on treating the bit that seems to be the problem until the cows come home. You can continue and they will not get better because you're not treating the right thing. So I want to share with you that once you find out once you realize that the problem is most likely in your pain system, it requires a different treatment.